Our next session is a parent's journey navigating asthma. Next, we're excited to present this session. It's an insightful session that will explore the challenges and advocacy efforts of managing asthma shared by those with firsthand experience. It is prevalent in our community. We tend to have higher rates of asthma, and we're getting it treated in emergency rooms. So we can do a little bit better than that. And so our esteemed panel will speak to us today about it. Leading our session is Mary Ruth Bremer, Director of Patient Advocacy at Regeneron. She has over 25 years of experience driving initiatives to improve care for patients living with asthma and COPD. Also, she has been a wonderful friend to Black Health Matters, believes in our mission, as you can see, she doesn't talk the talk, she walks the walk. So thank you for being here. Joining her is Ali Boutin. She is a seasoned advocate dedicated to amplifying the patient voice and improving access to care. And LaJoy, a devoted mother and exceptional advocate with her daughter, for her daughter with asthma and for inspiring communities. Is your daughter here? Why doesn't she stand? Are you proud of mom today? All right. She's ready, honey.
Ready, Miss Ross.
We extend our heartfelt thanks to our sponsor for this session, Sanofi Regeneron, for their generous support. Now, let's give a warm round of applause for Mary Ruth Brenner, Ali Boutin, and LaJoy.
Thank you so much for the warm welcome and introduction. And thank you all so much for coming and attending this session, specifically focused on asthma. Asthma is a respiratory disease that is usually characterized by chronic airway inflammation. And it is defined by the respiratory symptoms of wheezing, shortness of breath, chest tightness, and cough. And these symptoms can vary over time, and they also can be reversible. Anyone can be diagnosed with asthma from as small as an infant all the way through adulthood. And the severity of this disease can also vary from mild to moderate to severe and even life threatening if not treated accurately or appropriately. But today, we're not going to talk about the clinical perspective of asthma. Instead, we'd like to talk beyond the disease. We'd like to bring the human element of what it's like for a parent to raise a child living with asthma and some of the challenges that they live with from a day to day. And we're hoping that in sharing stories like today and bringing visibility to stories like LaJoy's and her family, that we can help bring a bridge of compassion, also a stronger understanding of asthma, as well as just bring in the community to help support all of those. And many of you are probably in the audience also impacted by this disease. So now, without further ado, I'm going to pass it over to Ali, my colleague, to get the conversation started.
Thank you, Mary Ruth. Thank you so much, LaJoy, for being here. We are so grateful for your time. And, we are looking forward to for you to share your story. So important. Can you tell us a little bit about yourself and your daughter, where you live, what city, what you do for work, what fun activities you do together?
Well, good morning, everybody. Okay, this is Black Health Matters. That is unacceptable. This is a joyous day that the Lord has made. Let's try it again. Good morning.
Good morning.
Yes. It's a beautiful day and we're all here, right? Because we know that it's a lot going on in the world, but we actually made it here today. So we have to really celebrate that. But good morning, everybody. My name is LaJoy Johnson Law. I am a proud Ward 8 resident. I have to shout out Miss Diggs. Like whenever we see Ward 8, we got to represent Southeast. Okay, come on, Southeast. As you all met my daughter, Miss Rosalind. Thank you for that beautiful introduction and letting her stand. Miss Abria is 13 years old. I'm gonna wait to tell my story. Do you want me to wait, or do you want me just to go into it?
Well, why don't you finish telling us a little bit more about
Okay.
what grade she's in and
Okay.
what she likes to
So
do?
what she likes to do. So Abria's 13. She goes to Eel Haynes Public Charter School. We're in the 8th grade. I don't know what happened. Like, I just had a baby like 13 years ago, and now she's about to go to high school. I don't know what happened. So I'm really, really proud of her. I work as a contractor with Advocates for Justice and Education. And more recently, I just got elected to represent all of Ward 8 on DC school board. So I'm really excited. Yeah. Yes, yes. There wasn't a mom on the board a couple years ago, but I'm the only mom on there, and I take that with great pride because I love our children, but I also love our children in regards to health matters and making sure they have what they need. Um, Big shout out to Ward 8, y'all, really quick. It's a really quick plug. We haven't had a hospital. Ms. Diggs, how long has it been? It's been a long time. You guys, we have a hospital that is opening next week. Black Health Matters. I need you all to go to Ward 8 in Cedar Hill Medical Center that is managed by GW, that is serving Black residents. And so I have to shout out when our Black communities are doing amazing things in the health field. So, really quick plug.
Thank you, LaJoy. Great work that you're doing. So just talking to you before, I know there's a lot that we could spend all day talking
Yeah.
about your journey caring for your daughter with asthma.
Yeah.
We'll be have several questions. So we're going to
Okay.
start with early times, early diagnosis, and the early years. So Mary Ruth, you have some questions?
Yes. So, oh, I should use the microphone. LaJoy, you mentioned a little bit about you and about your daughter. Can you walk us through kind of the early start with an asthma and kind of, how she was first diagnosed and understand that a little bit, and then we'll move into the current here today.
Absolutely. So, this is an interactive activity. Everybody hold up your right hand like this. That includes you all, Mary Ruth Alley. Everyone hold up your right hand. Okay. Now go like this, like a scoop. I promise there's a reason. There's a reason for this. Okay. Abria was born at 1 pound and 6 ounces. This is how big she was. That's it. This child was not supposed to be here. This is a miracle baby that you all see here today. And there was a lot going on. Exactly, it was a lot going on. She was in the NICU. She was supposed to be born in December, but we were born at 23 weeks. She's here. And she was not supposed to be here. They talked about chronic lung disease very early on. She was in the NICU for like 4 to 5 months. And right after she got out the NICU, we were right back at the pulmonologist and the pediatrician. Like, that's how sick she was. And she was sick for a really, 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 really long time. Our first appointment with the pulmonologist, they talked about she's gonna need to be on oxygen. She's gonna need to be on an apnea monitor. So basically, for those who may not know, a breathing machine. So she needs to be on oxygen. She needs to be on a breathing machine. And so when she would be in her car seat, we would have like her in the car seat and like me and have her diaper bag. I lived on the top floor without an elevator, dear Lord. And so like it's like her diaper bag. Y'all, I'm just trying to give y'all a visual, like the apnea monitor. And then we have to like hold the oxygen to be able to just keep her breathing. And this is in rotation with just all of her medication. Like, we had to give her nebulizer treatments, constant medication. Abria also has seizures. So that's another story for another day. But I'm not gonna lie to you guys. It was it's challenging caregiving. Is anybody here a caregiver or has experienced caregiving like for a loved one? So you all know that journey. You all know that life. It's a lot. Or even if you're a parent, like, for our parents in here, that is a form of caregiving. Even if your child doesn't have a special health care need, right? Shout out to my mama with the baby. We love you. Seriously. Because it's a lot caregiving, right? And then when you have a child that has special health care needs, we've amplified this by like 3 times. That's a lot going on. And just trying to keep her moving. So we had to, her health team, not including the educational journey. That's another story for another day. We're gonna focus on health today. And so that's how it started. It's She is doing wonderful. She's doing wonderful. She really is. But I think that is because of the care and also just, I'm gonna be real with y'all. This is a Black Health Matters Expo. So, really quick. When Abria was born, the doctor said, "Hey, Miss Law, we just want to talk to you about your problem." And I was really confused. I was like, "Problem?" I didn't know what that meant. Well, we have programs for substance abuse. Substance abuse. I'm like, I don't understand. Well, the doctors thought I was on drugs. Oh, and that's why she was born so early. And this is not new in the Black community. And so I said, instead of you sitting up here asking if I'm on drugs, we need to figure out, okay, what underlying health conditions made her get here so early. We need to be figuring out how we're going to keep her here. We need to be figuring out what type of rotation of medication she needs to be on. We need to be making sure that she has intervention. You need to be raising up Black mothers in the maternal mortality rate. You need to be thankful that she's here. You need to be thankful that I'm here. That's how I got into advocacy for health. That's why I serve on health services for children with special needs, their board of directors, to make sure children like Abria, have advocates in the health field. Because how many people are advocating for our children? How many people are advocating for children that have special health care needs? It's a lot going on. And I don't have to tell you all, one inhaler is a difference between life and death. So that's why I show up the way that I do. This is why I always put my faith first. This is why I'm thankful for the two of you for having me on here to not only share our story, but to uplift the stories of millions of families who may not be able to tell you.
Thank you. Thank you so much for sharing a real normal, unfortunately, issue that is often the case in this community. And thank you. And we're so thrilled that your mother's here and that Aubrey is a healthy 13-year-old. And so we would love and be curious to better understand in the day to day, now that she's 13, what are some of the triggers that you all are, you as well as your family member and even at school are kind of monitoring that could worsen her asthma?
And before I answer that question, I have to honor the queen. Mommy, can you stand up? We wouldn't be here without you. For a really long time, she was helping me manage the day to day for a really, really, really long time. So now that Abria is 13, it's not as bad as it used to be, but she does take medication twice a day. She does have her inhaler, or she has an inhaler, but we also have a spacer. So when she's like, I don't want to do this, girl, come on, spacer here, let's go. And so we have her spacer with her medication that she gets twice a day. Abria does have an asthma action plan that we do have at school. So I'm sure, I feel like you all know this, but I'm going to share it anyway. On the asthma action plan, there are 3 parts. There's a yellow part, which is like your normal day. There's, okay, I feel like I'm about to get sick, so let's go into like yellow. And then you have your red part where, the asthma is inflamed. And so usually, like seasons, allergies, that triggers her. The pollen triggers her. And then also too, just, because she was born so early, just the common cold really, really triggers. And so it was a point where we were literally at the hospital at least once a month. I kept begging for them to like build me a condo, but they said no. I was like, come on, children's. And they were like, Miss Law, no. I'm like, but we can rotate it out, we'll work on it. Anyway, so, but just the medications day to day, like when she's going with my mom, it's everybody has like their own spacer. The school has their own spacer. I have a spacer in the house. There's a spacer in the car. It's literally like everywhere we turn, there she has her medication. So it looks a lot better. I did try to get her involved with sports. That's a little bit of a challenge because we have to monitor. So any activity that she does, any physical activity, whether it's recess, sports, anything, she has to take her inhaler before. And so, is it still a lot to manage? Yes. Is it better than what it was? Absolutely yes. You have to get a really great healthcare team. I think that's the difference. A healthcare team that helps you manage it all, that puts you on the right medication. And also when you're saying, hey, this doesn't look right, they're actually listening to you. I think that's the other thing, like patient advocacy and making sure you're working with your medical team and working with your doctors. And thankfully, this child has had an amazing pediatrician and an amazing pulmonologist. So thank you.
Thank you so much for sharing that because, as we've learned, and I know many folks in the room today also understand that, the pediatrician is the first doctor that, you have at birth, but it's also important to understand who are the specialists, who are the experts. So I'm glad to hear that the pulmonologist also plays a very important role and, making sure that she can get tested once a year with spirometry and just kind of make sure that her lung function is there. I'm curious to understand, you mentioned education. Where have you gone and what have you gone to websites, offices, organizations? Where have you found to find the most helpful information for you to learn more about asthma?
So I think the biggest s- I think maybe like one stop shop was honestly the pulmonologist. And so at Children's National Hospital at the pulmonary team, they have many different CBOs. Do y'all know what that means when I say CBO? Okay, CBO is a community based organization. So like our local nonprofit organizations that either specialize in asthma or like something called Breathe DC. Usually they're 501c3s that come and partner with the hospitals, with the organizations to be able, to work with families. And so that was honestly like one of the biggest game changers in figuring out, okay, again, I'm a new mom. Like the mom I am today at 13 was not the mom at like a Bria at 2 or 3. Like I'm trying, you're trying to figure it all out at the same time. And so the pulmonary team introduced me to an organization called Breathe DC, and they had a website. They work with children's. I mean, they came to the house. They were like, we are going to come and do, because I'm in an apartment. They were like, we're automatically sending pest control. We're automatically going to test for mold. We're automatically going to give you all. I mean, it was like a folder, like maybe even like it was big as a binder full of just resources across the city. They even provided us a new vacuum, y'all. No, seriously. No, for real. To make sure that, like when I'm cleaning and vacuuming, that the dust is not triggering her asthma. And that was actually one of the triggers that I didn't, I'm 2, she's 2. I don't know these things. This is new. This is new for me, right? And again, allergies and when all the things that are coming into the house. So we had to take off shoes. That was one of the things they told us. They were like, take off your shoes. Don't track all that stuff in the house. So it was all of these different educational matters that they brought to us to help us learn. And then also just they connected us to AFA. And I know AFA's here and we're thankful for AFA. So they have amazing, amazing resources that that they're showing different community members. I think one thing that we need to do better of, I don't think a lot of people in the Black community have all that access to information. So I think this is why I love Miss Roslyn and Black Health Matter. We got to raise these resources up. We got to raise these educational things up so that way people have access to them, which is why I need Miss Roslyn and Black Health Matter to come to Ward 8. That's
And
my plug, Miss Roslyn.
I'll plug onto that the AFA, the Asthma and Allergy Foundation of America, is right outside this door. They've got
They
a
are. They're
table up,
amazing.
set up tons of information on asthma if anyone wants to learn, and also the Asthma and Allergy Network is also down in the exhibit hall. But that's my last plug. I'll pass it over to Allie.
We love it.
Thank you, LaJoy. And, I'm just in awe. All the advocacy that you do. I mean, from your story, I can tell that along the way you've learned so much as a caregiver and you're sharing it with everybody. So thank you. And thank you for telling us about those day to day activities that you and Abria have to be mindful of and anybody who's caring for her. But when it gets really tough, can you walk us through those challenging times? What does it look like? What are the triggers, the symptoms, the initial symptoms that you're like, okay, I need to be on high alert?
So she's gotten better, but there are still many triggers that are out there. And at first it looks like, okay, there's a cold coming. So it's to the normal eye, oh, like, it's just like a little cold that's coming, whether if it's like a sneeze or a cough. But usually when a Brie is sneezing or coughing, there's some wheezing. And so automatically we go to her it's called her sick plan, her asthma sick plan. We automatically go to her asthma sick plan. But it was at a point in life, I'm not gonna lie to y'all, and my mama knows. We were just at the doctor. I swear it felt like once a week. And then she was all and then her pediatrician would go, Okay, Miss Law. And she would go, this was her, that was her transition. She would go, all right. I'm like, that means impatient. That means get ready. That means when I finally when we got our first vehicle, I just had like a hospital bag in the car, y'all. Like it, that's how bad it was. It was like a hospital bag by the door that we would stay. You know, y'all have like the anybody knows like for like pregnant women for when you're with child, how you have like the bag ready to go at the door. So in case something happens, this was the asthma bag ready at the door. This was the hospital bag ready at the door always, and I would have a bag in the car because let's say, oh, we're just going to a doctor's appointment for a checkup, she could be inpatient at any moment. They would literally admit her at any moment. And so I think that's the most challenging part, you know, just really not knowing. And so, as my mama would say, well, baby, if you stay ready, you don't have to get ready. And so, yeah, come on, love me some mama dudes, right? If you stay ready, you don't have to get ready. And so, staying ready for us looked like, okay, her hospital bag is on deck at all times because a lot of times she would be admitted. That it is what it is. Or as she got older, and this just happened actually a couple weeks ago with the seasons changing. We're not inpatient, but she's home from school for 7 days. And this child has an IEP. Do y'all know what that is? Okay. So, you know, we're missing valuable education time that she needs, and we're missing 7 days of school. And this was like last month because of the season that's constantly changing. So it looks like a common cold, but I know, okay, this is a trigger. So I'm just automatically going to put you on the sick plan. It's the first sign of it. There is no, oh, let's gradually go up to it. No, sick plan immediately because you're either going to be home or you're going to be at the hospital as an inpatient. So I'd rather have her home than her being an inpatient. And it was as far as like the school, we would her pediatrician, we would have to basically get like a doctor's letter that basically says, hey, this kid has chronic lung disease. And when her asthma flares up, she could be out for like days at a time. It wouldn't be like, you know, of course you have your doctor's notes, right? But this was like a standing letter that I had to put on file with the school because it was that bad. And so, and then trying to help the managing getting her medications at school and making sure the nurses have all those things. There's a lot that goes in behind the scenes, if that makes sense. And I'm sure everybody here knows if you've ever, just as a parent or putting on an event or just anything that takes a lot of work, there's a lot of work that goes on behind the scenes. And that's honestly like what caregiving entails. And as my mama would say, I am the chief executive officer of my household. I'm a solo CEO of the law household, and I take it with immense pride. But as a solo CEO, there's a lot to manage. There's a lot to manage with going to work. There's now I'm an elected official, so that's the other thing, right? I'm also a student. Y'all don't judge. I'm a PhD student. Y'all pray for me. Whew. I'm trying to be done this summer, y'all. Y'all pray for me because I'm ready. I'm tired. I'm ready for it to be done. Come on, Lord. I'm ready.
So thank you so much for sharing that with us. I can only picture how challenging that is. Um, Beyond the taking care of your daughter physically for her health, tell us about navigating the healthcare system, especially as CEO of the household. What does that mean? Tell us how you coordinate different specialists. What does that look like?
That's a really good question. Ooh, we could be here forever, but I'll take the express lane. So navigating healthcare in DC can be a little challenging. I cannot. We don't lie here. There are a lot of resources here, but it's also challenging here, especially for a child that has special healthcare needs. Abria is under a healthcare plan that I found out about when she was in the NICU. And the social worker there said, you know, this is a Medicaid managed program. They call them MCOs, which is Managed Care Organization, which is under the Medicaid umbrella. Okay. And I think currently there are about 6,000 of our kids that are currently on it. But also believe there are a lot of children who probably need to be on it who don't know. And so navigating Social Security, because that's one of the qualifications, navigating having a health qualification, right? Like a special healthcare need, working with the doctors, that's challenging. The renewal process, that's challenging. Trying to make sure you're in network, that's challenging. And so it's a struggle. We had a bit of a scare about 2 years ago where we got a letter in the mail saying, "Hey, we know you're doing good at your job. You know, she doesn't qualify for her insurance anymore. You got 14 days." Wait, this kid is therapy. We got speech, PT, OT, medication, doctor's appointments, neurological visits. She can't not have medication. And so there was some advocacy there where I'm saying, hey, like, do people know this is happening? And how do people stay connected? Because that's not okay. No child or person should be worried in this country about how they're going to afford healthcare or how they're going to have it. But we all know that we're in a very different time. So we're going to have to, I'm just going to be real. We have to step up. And if that means we have to step up in our own community and we do it ourselves within our own community, and we bring those who want to partner with us along, then that's what we have to do. But it's only going to get harder navigating the healthcare system, especially for children and individuals that have asthma, especially for children and individuals that have special healthcare needs. It's just going to get harder. So we got to figure out, how do we keep people planted? How do we keep people connected? And how do we get them to the resources to manage their care? Because that's the difference between, honestly, life and death, right? Well, yes, God himself, but honestly, it's really a good healthcare team.
Joy, you segue right into my next thought question, which is advocacy. I mean, you obviously found your voice, and I'm sure it's evolved with time since she was little to now, and you're on stage talking about your journey. Can you tell us about how you got started? How did you find that voice? And what has that meant really for the better care of your child?
Um, I think, again, we all have our own individual journeys, right? And I think finding your voice, honestly, for me, it started with getting knocked down a lot. It got started with people not listening to me. I mean, you all heard the story when she first got here. Are you on drugs? And I'm like, no, I don't know. I have a weak cervix. You know, there's stuff going on and I'm trying to figure it out. This new baby is here and she's a pound and 6 ounces. And you're asking me if I'm on drugs. That's not an appropriate question. And I said something, but I didn't really like buck back at the doctors. I was so focused on, is this kid gonna be here? Like, is she gonna make it? And I remember when everything went wrong, like my dad died in 2015 and I lost my job and I lost my marriage. And then we lost my grandmother. And then she was inpatient at the hospital. And it just felt like, you know how y'all anybody everything goes wrong at the same time and it's all just like literally just gone to hell in a handbasket. And you're trying to figure out, what are you going to do? And it was then where I said, well, who's going to stick up for my baby? Even though all these things are going wrong, who's going to make sure she's okay? None of these people are going to fight for us. And sometimes, do I get help? Sometimes, but at that moment, at that time, I wasn't getting a lot of assistance. And trust me, y'all, I was looking and I could not figure out what to do. I could not get any help. And I said, well, if no one's going to help me, then maybe I need to dry my tears and knock the door down myself. Because you're not about to sit up here and treat this child like this. You're not about to sit up here and say, okay, you lost your job, so everything is just going to fall. And that is all, and that it just sits on our shoulders. No, that's not how we do. When we talk, y'all want to, let me tell y'all something. When people talk about patriotism, patriotism looks like serving your own community. It looks like helping somebody else. And it looks like advocating for somebody else, because you never know what somebody's going through. Everybody's going through something. And when we share our story, I'm praying today that this has helped somebody who knows somebody to be able to uplift their voice.
Absolutely.
It just takes one. Y'all remember that. It just takes one. That's it. It just takes one voice.
Thank you, LaJoy. Oh my gosh, so true. And what a great example to all of us, and especially to your daughter, to speak up and, you know, never quit on that. But on the last minute, can you just tell us what you would want someone, everybody here, to remember? If it was one thing that you want them to take away, what would you say?
I think the one last thing I would say for maybe those who may feel voiceless is that you can do this and don't give up. I know if you feel like you want to give up, and I know things are really, really hard right now, but you can't give up. God has a plan for you. God has marked a door for you. Just take one step. Put one foot in front of the other because it is challenging. It is hard. It may not get easier, especially with the type of situation that we are in with this country. So we got to put one foot in front of the other and grab on and hold on to somebody that can help you put one foot in front of the other. This is not the time to lay low. This is not the time to give up. Raise up your voice. Share your story with somebody in your community. Share it with your neighbor. Share it with a friend. Share it with a family member. We can no longer be silent. That's my advice. The time for silency is up. The time is now.
Thank you,
Thank you so
LaJoy. Thank you
much.
so
Thank
much
you.
for sharing your story. Thank you for sharing. Hopefully, all of you in the audience feel inspired. And also, if you recognize some of the symptoms and the challenges that LaJoy was speaking to, go to your doctor, talk to them about the symptoms, and also feel free to work within your own communities to help strengthen the support of everyone within there. So, thank you so much.